Talk about a disease called as a myasthenia gravis. So myasthenia gravis is very important disease occur in many person. It is not that's kind of is a very rare disease. So let's what is the pathogenesis of the myasthenia gravis and how it's occur. So this I have taken as a reference, which is the first aid book, very good book. Okay, so what is the myasthenia gravis? Let's see. So myasthenia gravis has the first of all, it is a most common disease which has of the neuromuscular junction disorder. And what is pathophysiology is it is a post-synaptic acetylcholine receptor antibodies. तो देखियो this is the neuron and this is the any upper our skeletal muscle. So what occur normally whenever this calcium influx occur, the acetylcholine filled these granules filled with acetylcholine release at this site, and it releases the material which is the acetylcholine, and here is the receptor of the acetylcholine called as acetylcholine receptor. Okay, so acetylcholine has a two type of receptor, which is the N type and N type. So the N type of receptor has the nerve to nerve terminal. This is one neuron, this is one neuron. Between them it is N type of receptor, and between a nerve and between a muscle, that is NM type of receptor. So the antibody which is formed against this acetylcholine receptor NM type of receptor. So what will occur whenever this acetylcholine comes in this synapse में जब भी ये आएगा, it can't bind to the acetylcholine receptor because there is autoantibody has destruction of this receptor. By the destruction of this receptor, the acetylcholine will not do its function on the skeletal muscle. So the skeletal muscle will be loss of its function, and whenever this muscle, it will be loss of this function. If it is the respiratory muscle, let's see what are the clinical feature of this disease. The clinical features are, if the muscle is a respiratory muscle, there will be dyspnea problem, which is diaphragm. If this muscle is bulbar muscle, there is dysphagia, difficulty in eating. If this is the muscle of the eye, there will be ptosis and diplopia in the eye and difficulty in chewing if this is a pharyngeal or laryngeal muscle. So ptosis, diplopia, dyspnea, dysphagia, difficulty in chewing, these are the clinical example or clinical features of this myasthenia gravis. Associated with what occur, it is thymoma or thymic hypoplasia, because this antibody these are the antibody which form in the thymus, or not form actually, it matured in the thymus. Thymic hypoplasia will also there. Okay, so in this condition, whenever the patient will come, how we can gonna to proceed? So first of all, that is problem in this receptor, right? So what we are gonna do, we can give, so this is not like that there is only one receptor, there are many receptor, and if the antibody is formed, let's say antibody is formed against this two receptor, okay, but this other receptor is spared normally. So what we can do here, if we provide extra acetylcholine, so there will be a high concentration of acetylcholine and it can bind to this receptor also, and these symptoms, which is diplopia, dysphagia, this can go away. So in this patient, what we are going to do is, this is the treatment procedure, how we are going to do. This is the treatment. We are going to do acetylcholine esterase inhibitor or anticholine esterase. So there will be no degradation of the acetylcholine, like pyrostigmine, neostigmine, physostigmine. Pyridostigmine is a drug of choice for this condition. We can remove the thymus gland, so there will be no antibodies, but there are many pros and many cons. Actually the cons are very large according to the giving the oral acetylcholine esterase inhibitor. We can do plasmapheresis, remove all plasma of the patient and remove anti-specific antibody, which are the this antibody which are again the acetylcholine receptor, anti-acetylcholine antibody will be removed by plasmapheresis. For the decreasing immunity, we can give him steroid, and complement inhibition, we can give him monoclonal antibody. The drug name is eculizumab. Whenever at the end there is a mab, which is, it means it is a monoclonal antibody, eculizumab. And the steroid are the prednisolone, azathiron, cyclosporin, we have learned already. Okay, how we can diagnose this condition? For the diagnosis of the condition, so this is I'm gonna to show, this is the tensilon test. This is the before the test. The ptosis, the right sided eye function is not occur properly. Whenever the person is seeing downwards, this one eye, right side, is not following his command, means there is a no skeletal muscle action, orbital muscle action in this condition. But after the tensilon test, after the administration of the drug, it is corrected immediately. So it diagnoses the condition that the person has the myasthenia gravis. The famous celebrity Amitabh Bachchan has diagnosed with myasthenia gravis. This is just interesting fact that you can remember more. Okay, what is tensilon test? So in tensilon test, what we do, we give the tensilon test is basically this test, what I have shown you just now. Let's see in okay, this is tensilon test, right? Tensilon test, what we do, we give the drug which is the acetylcholine esterase inhibitor. What will this drug do? Idrophonium, which is short acting. So idrophonium, short acting drug, if we give this drug, the person has the myasthenia gravis, or the symptoms is due to lack of the acetylcholine. So whenever we give idrophonium, there will be a high acetylcholine in the synapse. So high acetylcholine will be do immediate disappear ऑफ द सिम्टम. और जब ये इमीडिएट डिसअपियर हो जाएगा तो अपन को पता चल जाएगा कि ये डिसीज थी जिसके ये सिम्टम्स थे, रेस्पिरेटरी डिप्रेशन, ये ऑप्टोसिस, डिप्लोपिया, ये इसके कारण ही थे. सो एड्रोफोनियम is the drug test, because we have to use short acting drug, right? Long acting we can't use. That person will show the effect after 1 or 2 hours. This is the half life of this edrophonium is 2 or 3 minutes only. In 2 or 3 minutes or in 5 minutes maximum, the edrophonium will show effect, and this is how it's shown the positive effect. Diplopia is not occurring in the what to say, the right eye is not functioning. After 2 or 5 minutes it's functioning very well. So this person is diagnosed with the myasthenia gravis. How the other test what we can do, it is the antibody test in the plasma. So we drew the serum blood of the patient and do the antibody test, and if we find the antibody against this acetylcholine antibody, so this is anti-NR antibody, it is also one test, tensilon test by the hydrophonium that we have. The other test is provocative states or proactive test, in which we give him D-tuberculin. So it is very dangerous test D-tuberculin. This D-tuberculin, what will do, it will reduce acetylcholine synapse. So the symptoms will be worsen. So the patient come to us, he has the problem of the muscle weakness, dysphagia and dyspnea. What we do, we give him D-tuberculin, so acetylcholine decrease furthermore in the synapse and condition will worsen. The person said, after you administered the drug, I have more symptoms. So it diagnosed the case with the myasthenia gravis, but we can't do, because if respiratory depression occur below the level, if we have no facility of the ventilator and we give tuberculin, the person will die, right? So we can't do the tuberculin test in the routine without the ventilator or without the advanced life care support. So we have to do the antibody test, which is the good enough, and another one is tensilon test by the hydrophonium. So these are the diagnostic test, tensilon test, provocative tests, and antidote. These are the banned test, or we should not do by the D-tuberculin, because its risk of the death is there without okay, so how we can adjust the dose of the hydrophonium? For the adjustment of the dose, what will happen? The person will come. A person has the clinical feature like dysphagia, ptosis, diplopia, dysphagia. Okay, if the person can be in two state, which is the myasthenic crisis, in the myasthenic crisis, or in the cholinergic crisis. What is myasthenic crisis? Myasthenic crisis is that antibody is dominating our drug, so the drug effect is not come, so the person has the symptoms. This antibody is dominating, so the person has symptoms. What we have to do, we have to give him adrophonium. By the adrophonium injection, the person has the improved the symptom. If symptoms is improved, it means the we have decreases the, we are giving low dose, because the person need more dose, because the antibody is dominating at this stage. So we have to, what to do, we have to dose increasement, that we have to do. If person is in cholinergic crisis, means person will have the same symptoms: dysphagia, diplopia, difficulty in speaking, difficulty in chewing. In this condition, first of all, why this condition is there? Because the repeated stimulation of the receptor made the receptor inactivated. So person will go in lethargy and cholinergic crisis. If we give him more adrophonium, the person situation get worsen, because it is more repetitive stimulation of this receptor. So it states that we have to decrease the dose of our pyridostigmine. So this is the dose adjustment test. This is called as a dose adjustment test. How we can adjust the dose, means how we can decide our dose is decrease or increase. So we have to do increase or decrease. How we can do? If the person is myasthenic crisis, person is improving, so give high dose, or person is in cholinergic crisis, the condition is worsening, give him low dose. This is all right in here. The person is in myasthenic crisis, improve the movement, improve the weakness, we have to increase the dose. If person is in cholinergic crisis, worsen the condition, repeated stimulus due to the desensitization of the receptor, we need to decrease the dose. This is how myasthenia gravis is occur. So this I have shown you antibody against the acetylcholine receptor. The another condition is also there, which is called as Lambert-Eaton syndrome, in which the person has the antibody against this calcium channel. So this calcium antibodies against calcium channel, so calcium will not influx will be not occur, and if influx will be not occur, acetylcholine granules will not release in synapse. So there will be the same symptoms in the Lambert-Eaton syndrome also, which are in the myasthenic gravis. So same symptoms, but the etiology is different. Etiology in the myasthenia gravis is antibody against the acetylcholine receptor. It is post-synaptic defect. And in the Lambert-Eaton syndrome, the receptor, the antibody is formed against this calcium channel, so it is presynaptic defect. Although I have already said to you, this neuromuscular junction disease is most common, which is the myasthenia gravis only. Lambert-Eaton syndrome is very uncommon and very rare disease. So this is myasthenic gravis, this is tensional test, this is famous personality, who is Amitabh Bachchan, who got the diagnosis of this myasthenia gravis. Okay, so this is how it works, diagnosis is treatment and all. Thank you.